Hello and welcome to the Radnomics case of the week. Today we're looking mainly at this CT thorax, and this is a 30-year-old patient that's presented with chest pain and shortness of breath. We can see as we scroll through this CT thorax there are multiple thin-walled cysts. These cysts are seen throughout all lobes, with no real distribution in the cranial caudal dimension. There is a left-sided pneumothorax associated with this, no pleural fluid. Mediastinal structures on these windows look okay. We can't see any subcutaneous emphysema or any pneumomediastinum here. So I'm going to start writing a few of these findings into our RadCoPilot. So 30-year-old female with SAV and chest pain, and we can say something like multiple thin-walled pulmonary cysts throughout all lobes, no solid component, left pneumothorax, we can say lungs otherwise normal, and then let's have a think. We might want to use a template here to help us with this report, so let's select the CT thorax template. I'll go back to our reporting, and then there was another finding here that's quite interesting on this scan. If we look down on the abdomen, we can see that there is a large mass arising from the left kidney. It looks like it has a kind of exophytic association with the kidney, and we can see this really low attenuation material within it in keeping with macroscopic fat. So we could say something like incidental large exophytic left renal mass containing macroscopic fat. And let's see what we can do with that. We'll have a bit of a scroll through the rest of the scan as well to double check things, but the report's been generated for us in the background. We can see that it's fleshed out our kind of punctate findings into a nice report here, and it's given the conclusion here, multiple pulmonary cysts with left pneumothorax, and it's spoken also about this left renal mass, and even said it's likely to be an angiomyolipoma. Now, we might be a little bit shaky on the differential here for our pulmonary cystic lung diseases. So let's see whether RadChat can help us come up with a differential. Yeah, so it's given us a bit of a differential here. It's suggesting LAM, Burnt-Hogdey-Bay, pulmonary Langhans-Hill cytosis, and a couple of other diagnoses here. And actually, given the patient has this angiomyolipoma, we've got to think about something like tuberous sclerosis, and that is known to be associated with LAM. So now, with that in mind, let's add that into our impression. Are suggestive of background tuberous sclerosis with associated LAM. Good. And we can accept that report and move on to the next one.